Hello everyone, I am Dr. Kishore KV, neurologist and epileptologist from NIMHANS. So, as part of Ashur Medical Institute, we are taking classes on many topics, and today's topics will be saccades. So, what is this saccades? It's a rapid eye movement to bring objects of interest onto the fovea. So, this is because the fovea has been evolved and the saccades have been evolved to bring the object of interest from peripheral retina to the fovea. So, as humans, we have fovea, so we also have saccades. Rabbits does not have fovea, so the classical saccades which has been described in humans is not there. So, what are the salient features of saccades? The fastest of eye movements, which includes voluntary and involuntary changes of fixation, quick phases of vestibular and optokinetic nystagmus, rapid eye movements in REM sleep. So the types of saccades, the quick phases which we discussed, the spontaneous saccades when we are scanning the environment, the reflexive saccades due to visual stimuli, auditory stimuli, any other stimuli. Coming to voluntary saccades, the major group, the anticipatory, when you are anticipating something and you are looking for it, the memory based on the visual memory, there is saccades towards that particular position, anti-saccades away from the object of interest, and saccades to commands. So saccades are mainly generated, these are as definition rapid eye movements. The rapidness comes from the pulse generated by the burst neurons. Okay, so the step is to maintain the fixation in the new position. Okay, so there are three types of cells mainly. So omnipost cells, which is inhibitory to the burst neurons generally, so that there cannot be any spontaneous burst, and then burst neurons and neural integrators. The burst neurons which will produce the pulse, and the neural integrators is one responsible for step. Okay, so pulse means to reach the object of interest, the step is to maintain in that position based on the elastic recoil and other resistant forces in the eye. So saccades, the control of saccades, the higher control will be from the frontal lobes, especially the frontal eye fields, supplementary frontal eye fields, dorsolateral prefrontal cortex, parietal eye fields, basal ganglia, thalamus, superior colliculi, cerebellum, vestigial nucleus and its connections. And lower down in the brainstem, we have omnipost cells. It's common for both horizontal and vertical and torsional saccades, that is raphe interpositus in pons. The burst neurons, horizontal saccades will be PPRF in pons, and vertical saccades will be RMLF in midbrain. The neural integrators, the horizontal saccades will be medial vestibular nucleus and nucleus prepositus hypoglossi. The vertical saccades will be interstitial nucleus of Cajal. So omnipost cells will be inhibiting the burst neurons continuously, and before and during the saccades, these omnipost cells will become silent and the burst neurons fire and there will be rapid eye movement. Based on these elastic forces, a new position is maintained, that is step by the tonic supply from the neural integrators. So coming to brief examination findings, how to examine the saccades and what all to be seen, how to describe. So when we are telling the patients to look at a pen or your finger towards right or left, you have to look for saccadic initiation latency, speed, accuracy of reaching the target, sustenance of fixation in the new target, and saccadic intrusions. So these are the 5 things you have to look for in clinical examination. Saccadic initiation can be delayed in oculomotor apraxias, Huntington's, other dementias. The speed can be less or more. Hypo, that is, slow saccades can be seen in progressive supranuclear palsy. Accuracy of the reaching target, that means if it is not, it is under reaching the target, that means hypometric saccades. It is overreaching, that means hypermetric saccades. Hypometric saccades are seen in, again, degenerative conditions, progressive supranuclear palsy. Hypermetric saccades will be in cerebellar, especially vestigial and its connection damage. So fixation, if there is inability to fixate in the new target, mainly it drifts back and again go back to the target. So this is seen in nystagmus, and you have to look for saccadic intrusions. So saccadic abnormalities, saccadic latencies is abnormal. That means, so omnipost cells has, because it is inhibiting the burst neurons. So once the inhibition stops, only burst neurons can fire. If this inhibition is late, so the burst neurons cannot fire. Okay, so this is where the saccadic initiation latency will be delayed. And the velocity, if it is low, it is because of the burst cell pulse will not be strong enough. Unable to reach the target, that means the judgment of the burst cell to give enough pulse is not there. And if it overshoots, undershooting and overshooting both is very common in cerebellar disorders, but more commonly overshoots. And unable to hold the new targets, it is because of neural integrator problem, and it is seen in nystagmus. So coming to saccadic intrusions, these are a spectrum. The one end of the spectrum will have square wave jerks, macrosaccadic oscillations, where intersaccadic interval is present, and the other end will be ocular flutter and opsoclonus, where there is no intersaccadic interval. Ocular flutter will be the rapid eye movements in horizontal direction. In opsoclonus, it is in multidirectional. So the reference, this is from the Neurology of Eye Movements, Lee and Z. Thank you.